Hi, beautiful people. How are ya? I'm Dr. Pammy Jean. I hope you're having a great day. I don't know if you watched my last video, but I hope you do. I put a lot of effort into that, and it explains my klutziness, I think. I had a slight accident with one of my dogs, my granddaughter's dog, that left my back in, a little bit of pain. I was really okay, but, you know, my back is never quite right. I love that dog so much. Sometimes I think maybe she has vision issues too. She does some really dumb things when she's moving too fast. My granddaughter says she's just klutzy. So I guess we have that in common. But we'll keep an eye on her and see. I do have to get a x-ray on my tailbone, and maybe by the time I'm editing this for you all for Friday, I'll have gone to the doctor. Today's Sunday, and we have a lot of yard work to get done. So once I finish recording this, I'm going outside to use the trimmers. It's really bad out there. We've had so much rain that it's been hard to mow. My husband plans on picking tomatoes too, because he's been doing a lot of canning. That's keeping him really busy. I just help out where I can, washing jars out or helping him a little bit on, cutting up vegetables. I did snap some beans for him, a whole lot of beans, jars and jars of it, trying to get the garden taken care of because it's coming in to me a little bit early than it normally does. And it has done very well this year, I guess, from all the rain. So let's continue our discussion. Here we go. Let's begin with what is inflammation? Inflammation is not always bad. No, it's our body's way of defending itself against harmful pathogens, damaged cells, and irritants. It works hard to keep us safe. And when we experience short term, acute inflammation to heal and recover from those short term illnesses or deep cuts or injury, like maybe a broken bone, but it's that chronic, long term, or lifelong inflammation that can lead to a variety of diseases such as cancer, cardiovascular disorders, and autoimmune conditions. This is why the topic of inflammation is so important to researchers as they hunt and search for inflammation in people with fibromyalgia. Today, we're exploring this interesting topic, and we'll discover how fibro fits the bill. What is a cytokine? Let's begin our discussion with cytokines, those small proteins that are produced by our cells to signal or message other cells. I often mention these in our discussions, and I hope you are able to follow along. They're just part of our immune system, and they regulate our body's response to disease. Cytokines have many responsibilities, such as stimulating the production of blood cells, aiding in the development, maintenance, and repair of tissues, regulating the immune system, and driving inflammation through interferons, interleukins like IL 6 and IL 8, and tumor necrosis factor alpha, or TNFA. So, cytokine is an umbrella term that includes many types of protein messengers. There are more specific names for them. That depends on the specific job they do or the type of cell that makes them. Included under the umbrella of cytokines are lymphokines. These are made by lymphocytes. They attract immune cells such as macrophages. And macrophages are a type of immune cell involved in fending off infections as well as clearing debris during inflammation. And then there's monokines. These are made by monocytes and attract neutrophils. There are chemokines. These are chemotactic cytokines that are best known for stimulating the migration of cells, such as white blood cells called leukocytes. What is inflammation? All of these cytokines can cause protective or destructive immune and inflammatory responses. Inflammation is characterized by a series of physiological responses involving immune cells, blood vessels, and molecular and cellular mediators. When a cell is injured or damaged, an inflammatory response is initiated involving the secretion of pro-inflammatory cytokines, chemokines, and other signaling molecules. The purpose is to eliminate the initial cause of injury, remove those damaged cells, and initiate the repair process. Cytokines are key players in fibromyalgia. A review of research suggests a link between fibromyalgia, autoimmunity, infection, and inflammation, though it's not really fully settled. Studies show elevated levels of inflammatory markers like cytokines, IL-6 and IL-8, in the blood of some fibromyalgia patients, pointing to low-grade systemic inflammation. This could contribute to widespread pain and fatigue, sure. Neuroinflammation might be a factor, but more research is needed to fully understand the complexities of that. And we know that about half of us with fibromyalgia also have small fiber neuropathy. Cytokines are definitely involved in the attempt to repair diseased tissue. And hang in there, I'm going to talk about that too. Furthermore, it's believed that chronic low-grade inflammation has been proposed as a potential catalyst for sensitization of pain pathways. Shadow just laid down underneath my desk. So I'll repeat that. It's believed that chronic low-grade inflammation has been proposed as a potential catalyst for sensitization of pain pathways, which exacerbate the symptoms of fibromyalgia. We need to understand the role of inflammation in this disease, do we not? Immune system dysregulation is increasingly recognized as a significant factor in the development and progression of various neurological disorders, including those affecting the brain and spinal cord. So why would we think otherwise of fibromyalgia? This dysregulation can lead to neuroinflammation, a complex immune response within the central nervous system, characterized by the activation of glial cells, which would be microglia and astrocytes, and the production of inflammatory mediators like cytokines. Detecting neuroinflammation involves imaging studies like PET scans and magnetic resonance imaging, or MRIs. And these help to detect neuroinflammation. However, not all patients show clear inflammatory signs, and fibromyalgia isn't classified as a classic inflammatory disease like arthritis. Factors like stress, poor sleep, and altered pain processing may amplify inflammation's effects. Studies reveal elevated levels of pro-inflammatory markers, such as cytokines and immune dysregulation in patients. So, pro-inflammatory cytokines are key players in fibromyalgia's pain and fatigue. It just comes up over and over in research. Elevated levels of interleukin 6 and interleukin 8 and tumor necrosis factor alpha and IL-10 have been shown to be significantly higher in fibromyalgia patients. That's from a review of many, many studies that they're stating that as a fact. However, this profile contains both pro-inflammatory, which is the TNF-A, the IL-6 and IL-8, and anti-inflammatory, which is that IL-10, as well as the chemokine eotaxin as signatures, and also that balance of those pro-inflammatory and the anti-inflammatory, which is why it makes it so difficult to discover the exact markers of fibromyalgia or how much inflammation is occurring, but it is there. It may be this imbalance that causes the widespread pain and sensitization found in fibromyalgia. Let's explain what each of these do in our body. IL-6 ramps up pain sensitivity by acting on the central nervous system, and is often linked to widespread pain and brain fog. IL-8 is tied to inflammation and can heighten nerve sensitivity, making aches feel worse. TNF-A drives systemic inflammation, contributing to pain signaling, while symptoms such as fatigue, muscle soreness, anxiety, depression, pain, sleep disturbances, and cognitive issues develop. Recent research also points to IL-17, which may link the peripheral nervous system and our gut microbiota issues to pain via inflammation. These cytokines create a feedback loop and amplify pain signals. But there's also evidence from studies linking cytokines to fat tissue, inflammation, and metabolism, which might contribute to pain sensitivity and fatigue. Let's talk about chronic pain. Sometimes inflammation becomes dysregulated or persists beyond what was intended. So the repairing process now becomes the cause of damaged tissues and chronic inflammation. This ongoing process leads to the development of chronic disease, such as type 2 diabetes, cancer, chronic obstructive pulmonary disease, or COPD, and cardiovascular disease. Arthritis and joint disease affect almost 20% of the population, and nearly 2.1 million Americans suffer from rheumatoid arthritis. Allergies is the sixth leading cause of chronic human diseases in the U.S. Goodness. Asthma affects more than 24 million people in the U.S. There she is again. Over 8% of adults and over 8% of children were diagnosed with hay fever in 2015. talk about tissue damage. There's solid evidence linking inflammation and fibro to tissue damage via small fiber neuropathy. Evidence suggests degeneration and dysfunction of the peripheral nervous system, particularly unmyelinated fibers. Small fiber neuropathy involves damage to the tiny nerve endings in the skin and organs, which carry pain and temperature signals. Fibromyalgia patients have reduced small fiber density in skin biopsies, showing actual nerve damage. This damage can cause burning, tingling, or widespread pain, typical of fibromyalgia. In a 2024 review of studies, researchers confirmed this, noting small fiber neuropathy's role in heightened pain sensitivity, possibly triggered by those pro-inflammatory cytokines we talked about, like IL-6 or IL-8, which can harm nerve fibers over time. Unlike fibromyalgia's general muscle soreness, small fiber neuropathy shows measurable nerve loss, often seen in skin punch biopsies. Recent studies link small fiber neuropathy to immune dysregulation in fibromyalgia, suggesting inflammation might be eating away at the nerves. No major structural tissue damage, like in the muscles or joints, is consistently found, but the nerve damage is certainly real. Is small fiber neuropathy the one and only, or can we contribute our pain and inflammation to neuroinflammation, which is probably another link to this puzzle? Time will tell. Did it have to be so complicated? Good grief. The punch skin biopsy is the most reliable test, checking epidermal nerve fiber density with a quick 3 millimeter sample from your leg. Find a neurological center or neurology department and call them to find out if they do punch biopsies. That's what I'm going to do. That search engine out there, an AI search engine called Grok. Well, I asked her because I use a female voice. I asked her to search for me the closest neurological center that I could possibly get a skin biopsy done. And she found some locations for me. So I'm going to call them and find out. It doesn't hurt to ask. But always confirm with your doctor to rule out other causes like diabetes first, and my doctor has done that. And there is also QST, or quantitative sensory testing. The doctor applies controlled stimuli to your skin, usually on your hands or feet. I plan to go into more depth on these in the next video, so I hope you'll watch that as well. But have you had either of these tests done, biopsy or QST? Stay tuned for information on how to get diagnosed with small fiber neuropathy in the next video. And also more information on IgG antibodies. I dug a little deeper into that. So I plan on doing a video about that too. Researchers aren't giving up on any of these topics, so neither will I. I hope you learned something from all of this. I send you gentle hugs and support. Love you. I got my nails done, finally. They're so pretty. I love red.